morning, and thank you for joining us for the Syntero Forever Dublin presentation on your immune health. Maintain it and improve it. My name is Beth Baker, and I'm the Aging in Place Navigator for the City of Dublin and the Older Adult Volunteer Coordinator for Syntero. When Dr. Taylor and I planned this presentation, we were in the thick of the COVID-19 pandemic last February. With the number of cases rising each day, one had to ask the question, what can I do to mitigate the exposure and perhaps consequences of the disease should I contract it? There are a lot of factors, and we are familiar with the mask debate, distancing ourselves from one another and getting a vaccine. But the idea that we could help our body fight this disease is what immune health is all about. I'm so pleased to welcome Dr. Michelle Taylor of OhioHealth to speak today about what is immune health and how we can make our immune health stronger and more vibrant. Dr. Michelle Taylor, MD, is a board-certified family physician and faculty at the Dublin Methodist Family Medicine Residency Program. She is from Hilliard, Ohio, and completed her medical training at the University of Cincinnati and Riverside Methodist Hospital. Her medical interests include women's health, community medicine, wellness, and pediatrics. Dr. Taylor and her husband welcomed baby Nolan into their family this past June, and they have a daughter as well, and they make their home in Powell, Ohio. I do wish to inform you that this presentation will be recorded and archived, so if you choose not to have your video image recorded, please cancel the video option at the bottom left of your screen. Questions are welcomed and encouraged, and we ask that you utilize the chat function so the presentation may flow. Please welcome Dr. Michelle Taylor.
Thank you so much for that introduction, Beth. I'm going to go ahead and share my screen. Can everybody see this?
Yes.
Wonderful. So this is such a timely and interesting topic. And again, thank you for the introduction. Like Beth said, I'm a family physician by training, and I love to teach because I teach our residents here in our office every day. So let's see. There we go. So this morning, we're going to cover a few things. So in order to determine what you can do to promote your own health, you have to have a little bit of an understanding of what the immune system is and what are the different components of it. Then we're going to talk about how the immune system can malfunction or how it can go wrong. And then we'll list some things that we can do to promote optimal immune health for ourselves. A few disclaimers. This presentation is my own, completely original, based off of my knowledge and information, does not necessarily reflect the views of my employer, OhioHealth, although I don't think there's anything in this that my employer would object to. And a big disclaimer here is there is a whole field of medicine called immunology that you can get a PhD in, and this is a mere snapshot, the tip of the iceberg about immunology. So there's a lot more information that you can explore, and I'm going to list some good sources of information towards the end of this presentation if you want to learn more. In medical school, immunology was an entire course that we took during our second year. So let's start off learning about the human immune system. So there are many different components of the human immune system. What it does is it protects our bodies against infection. So infection from bacteria, viruses, fungi, parasites that can cause a lot of major problems in our bodies. It also protects against foreign bodies, things like if you get a splinter, your immune system actually helps you get rid of that and heal. And it also protects against cancer. So if something in your own body is going awry, your immune system can help you fight it. So clearly your immune system is incredibly important. So what happens when you get an infection? You have a bacteria, virus, or fungus that enters your body, and then your body will try to fight it. And sometimes your body is super successful and can fight it on its own without any intervention from the outside. But oftentimes when you have an infection, this causes problems such as symptoms. So if you get an infection in your lungs and you get a pneumonia, you'll have a cough and a fever, and you'll feel pretty bad. Similar things happen when you get infections in other areas of your body. So it just causes problems with the normal way that you function as a human. So we want to avoid it if at all possible and stay healthy. There are lots of different components of our immune system. There's an innate immune system and an acquired immune system. So let's start by talking about the innate immune system. And the first part are physical barriers to entry by bacteria, viruses, fungi, etc. Your skin is a major part of your immune system. It is the first and biggest barrier to any bacteria, viruses, etc. entering your body. It's a physical barrier that keeps things from coming in. It also has healthy bacteria that live on your skin that can help fight off if any bad bacteria try to get into your body. Also, you sweat from your skin, and that is a protection in and of itself because it kind of washes away any things that are trying to invade your body. Your GI tract is another major component of your immune system. Because your GI tract is somewhat open to the outside environment, we eat food every day, there's a possibility for infection to come through your GI tract. And many of you might have experienced, food poisoning or gastrointestinal illnesses as a result of an infection of your GI tract. But for the most part, our GI tract does a really good job of fighting off infection and fighting off invasion by pathogens. Your GI tract includes the saliva in your mouth. It includes the acid in your stomach, which kills almost everything that gets into it. And then it also includes the microbiome or good bacteria that are in your gut and in your intestines. Like I mentioned before, sweat and saliva are part of your immune system. Also mucus. So think about like the lining of your nose, the lining of your genitals, the lining in your ears even. Mucus is really helpful at kind of physically trapping any bacteria and making sure that your body gets rid of it before it can even have a chance to cause an infection. Same thing with tears. Your lungs have a special kind of physical mechanism to keep bad bugs out. They're called cilia. This picture is a really, really, really zoomed in artistic description of it. Basically, the cilia are like little hairs and they beat upwards to keep bacteria and viruses out of your lungs to prevent pneumonia and other respiratory infections. Fever is another innate immune response that you can have. So fever, your body recognizes that there's a pathogen around, and your body creates this non-specific response to try and prevent it from causing further damage. So when your body temperature is higher, some bacteria and viruses do not like that higher temperature and have trouble causing more infection in those states. And fever can even sometimes kill or stop the growth of those bacteria. That's not always the case. And fever is pretty uncomfortable. I'm pretty sure much of us, if you've experienced a fever in the past, like most of us have, you'll agree that it's not a super comfortable feeling, but it's there as a protective response. And it's not bad in and of itself, although it can make you feel quite bad. I've mentioned a couple of times the good bacteria in your immune system. We use the word microbiome to describe that. Essentially, you have bacteria all over your body, lining your entire GI tract, in your nose, in your genitals, everywhere. And that's okay. That's a good thing. These bacteria don't cause infection. These bacteria live happily on our skin and in our GI tract and such, and help, crowd out. If a bad bacteria comes around, the good bacteria might attack it, or there might just be too many good bacteria for the bad bacteria to even really have much of an impact. You'll hear a lot about the microbiome if you do reading on health and your immune system, and we're going to talk a little bit more about it later. All right, let's get into some of the more specific components of our immune system. So, and again, this is an entire course in medical school, an entire field that you can go into. So we're just going to scratch the surface of what your body does to help prevent infection. So there are different kinds of cells in your body. Most of them are called white blood cells that fight infection. Some of them fight infection kind of regardless of whether you've been exposed to it before. Those are called the innate immunity response. That happens as soon as your body recognizes that something's going wrong. And then there are some white blood cells that have a specialized response specific for a certain bacteria or virus. That is called adaptive immunity or acquired immunity or memory cells. Unfortunately, there's lots of names for these things. That response tends to be a little bit slower, but it is specific. It is laser focused at those particular pathogens. So it tends to be a little bit more effective. Again, we'll start talking about the innate immunity response. So you'll see on the screen, there are different types of white blood cells: macrophages, neutrophils, eosinophils, basophils. If you ever take a look at your blood report that you get at your doctor, you might see those on your blood counts, and those are what those are. It's normal to have those around at all times, and the numbers of those cells increases when you have an active infection or when your body is trying to fight something off. Those cells will either capture a bacteria. It'll even almost eat a bacteria. That's what macrophages do. They actually literally will consume a bacteria or virus to get rid of it, or they'll neutralize it by killing the bacteria. These are throughout our entire body, and when you have an infection, these cells go to the rescue and tend to focus themselves in the part of your body that it needs the most. I also listed on the slide this complement system. You don't really need to know too much about it, but complement are different proteins that your body produces when you have an infection or when you're trying to fight off an infection. They cause effects like a fever or like the muscle aches that you feel when you have an infection. Again, it's not a bad response, but it's something that you can definitely feel. And those proteins are another source of being able to fight those bad bacteria and viruses.
Dr. Taylor?
Yes.
May I ask about if a white blood cell essentially eats another bad bacteria, mm-hmm. Is the cell absorbing it in the cell, or is it expelled through bowels or something? Or
yep. So let's say you have a cut on your skin and there's some bacteria. Your body will send these macrophages and neutrophils and other white blood cells to the site to get rid of that bacteria. So what a macrophage does is it's a cell, so it doesn't have a mouth or anything, but it kind of envelopes the bacteria and degrades it. So it breaks it down with enzymes, and then it's eliminated through cellular waste, which eventually is filtered out by our liver and spleen, and then is eliminated.
Thank you.
So, and again, there are limitless questions, so feel free to ask anything. I mentioned that you also have an acquired immune system. So these B cells and T cells that respond specifically to specific bacteria or viruses. You have to have been exposed to it before to be able to have a fast immune response. If you have an infection that lasts for a while, sometimes you'll be able to mount this response during the infection. T cells sometimes are called killer cells. In fact, there's one that's called a natural killer T cell that sometimes can even kill bacteria without having seen it before. But for the most part, T cells and B cells are going to be very specific to something that you've been exposed to. This specific immune response forms antibodies, and the B cells are specifically the ones that form antibodies. We hear a lot about antibodies these days. For example, you may have heard that you can get tested to see if you have antibodies to COVID. Antibodies are proteins that your body makes that specifically latch on to a specific virus or bacteria so that your body will recognize it and then get rid of it. In this image, I believe this is supposed to be antibodies sticking to a COVID virus. You'll see that antibodies are Y-shaped, and the open part of the Y likes to stick to the virus or bacteria. And then the stem of the Y is still sticking out. That's where your white blood cells come to the rescue, recognize those stems of the Y sticking out, and will get rid of those viral particles or bacteria. The part of the Y, the two-armed part of the Y, has to be very specific in order for it to stick to the virus. So you form antibodies when you're exposed to something through natural infection or through immunization. And I gave a talk on immunizations several months back for this group, but we're not going to go through the details of how immunizations work. But essentially, it's like pretending to be exposed to a bacteria or virus before it actually happens, so that you can form these antibodies, so that your body, when you get exposed to the real thing, is prepared to go attack it as fast as possible. There's some other organs in your body that are associated with the immune system. So you have lymph nodes. You can oftentimes feel them in your neck. Especially when you get a cold, you might notice that they get enlarged a little bit or feel full. That's essentially where the B cells and T cells like to hang out, is in your lymph nodes. So when you get an infection, they get activated, which is why they enlarge and why they get a little bit tender. I discussed your spleen a little bit earlier, so it helps filter out the harmful particles and harmful cells kind of once they've been neutralized by your body. Your tonsils in the back of your throat, if you haven't had them removed, are another source of immune tissue. And then you have a gland called the thymus that sits right in front of your heart, kind of right here. It gets much, much smaller as you get older. Most adults have a barely appreciable thymus. It's not something you can feel. It's below your chest bone here. But it also is a really good source of those T cells that fight infection. So now that we've briefly gone over, maybe in a little bit too much detail, the normal immune system and how it works, how can things go awry? How can things go wrong? Well, you can get an infection. This is what the immune system is trying to prevent. But sometimes your body can't prevent infection. Sometimes infection is, it happens. There's either too much bacteria or it's too strong, or a virus, there's too much virus and it's too strong for your body to successfully clear it without help. Infections include things like pneumonia, I already mentioned. You can get an infection of your skin called cellulitis. You can get an infection of your GI tract called gastroenteritis or colitis. And you can get infection in your urinary tract, often called a UTI or a cystitis. Now, if you're into semantics, you'll notice that itis is at the end of all of those. And honestly, that just means inflammation. So it doesn't necessarily mean infection. However, colloquially, when we're referring to these things, those are due to infection from a bacteria or virus or fungus or parasite. Another way the immune system can go wrong is if it doesn't work well to begin with. And there's lots of different things that can cause the immune system to not work as well as it should. There are different chronic diseases that can impact the effects of the immune system. Things like diabetes. If you have too much blood sugar and there's too much sugar in the different tissues of your body, that makes the immune cells a lot sluggish, essentially. They can't do their job as well. They don't work as well. Similarly, there can be harm to the physical parts of the immune system. So say you have eczema and you often have breaks in your skin or inflammation of your skin. That causes that part of the immune system to not work quite as well. Some more specific things that more specifically attack the immune system include HIV, human immunodeficiency virus infection, or AIDS, which is a virus that very specifically attacks the immune system, specifically T cells, to prevent them from working as well. Persons with uncontrolled HIV can have all sorts of infections, including by bugs that don't cause infection in people with a normal immune system. Cancer can impact the immune system. At the beginning, I mentioned that part of the normal immune system's function is to fight cancer and prevent it from happening. However, once you do have cancer, sometimes you can even get cancer in the immune cells. Those are called leukemia or lymphoma. Additionally, to treat cancer, we use medications like chemotherapy that kill off most of the natural immune system. That is why when you have cancer, you're often more susceptible to infections, including infections with bugs that don't necessarily cause illness and keep a normal functioning immune system. There are also relatively rare causes of inherited problems in the immune system. So there's severe combined immunodeficiency, where your body has a genetic defect that it cannot produce immune cells like it normally does. Usually that is present at birth, and you usually find out about that in childhood. Autoimmune disease is another way that the immune system can go awry. In autoimmune disease, your body recognizes your own cells as if they were foreign, as if they were something your immune system was trying to get rid of. This can cause a lot of inflammation and a lot of problems. Some examples of autoimmune disease include celiac disease, Crohn's disease, psoriasis, lupus, rheumatoid arthritis, and many others. Hashimoto's thyroiditis is another really common one. So in autoimmune disease, again, your body mistakenly recognizes the normal cells of your body, usually in a particular part, as abnormal. So your body attacks itself. Allergies are another way that the immune system can malfunction. So, and not just seasonal allergies, sometimes very serious allergies like anaphylactic allergies to various things like peanuts or bees. In this, your immune system essentially gives a really strong response to something that's really not going to cause any problems. Cancer is another way that the immune system can go awry. Like I mentioned before, the immune cells themselves can grow abnormally and will stop functioning as immune cells, but will grow out of control in a cancer like a leukemia or lymphoma. Aging can have a lot of negative effects on the immune system. And unfortunately, it's across all of the different ways that the immune system works. So in regards to the physical immune system, with age, oftentimes your skin is less stretchy and pliable, so it's more likely to get cuts or tears. You produce less saliva and tears and mucus, so that's less able to kind of flush out the bad bacteria and viruses. You make less acid in your stomach, even though it might feel like you make more, but you make less, so making you more susceptible to infection that way. Additionally, as you age, the function of those specific immune cells often goes down in a non-specific way. On top of that, oftentimes, as you age, you acquire some of those chronic diseases that can make the immune cells work less well anyways. So there's lots of different effects of aging on the immune system. So with that, how do we promote immune health and make the most of what we have? Well, This first one here shouldn't be too much of a surprise, although it's probably the hardest one on all of the things on this list, but it's definitely the most important. So maintaining your overall health as much as possible. So let's go through this list. Good nutrition, consuming a healthy diet. What does that mean? Consuming whole foods, not necessarily shopping at Whole Foods, but consuming whole foods. So whole fruits and vegetables, grains, whole grains, beans, nuts, meats in moderation, oils in moderation, avoiding processed foods. Having good nutrition will provide you with good support in terms of antioxidants and other things that will help your immune cells work better. Physical activity. By staying physically active, you keep things moving inside your body, not just with the muscles, but with your immune cells. Going to the doctor and seeking preventative care. I'm a little biased as a family physician because this is what I do a lot, but making sure that you are being screened for common diseases that can impact the immune system. So things like making sure that you have your colonoscopy to screen for colon cancer. Things like making sure that if you are at risk, being screened for diabetes, because diabetes can severely impact the immune system. Keep your skin healthy. So this means keeping your skin hydrated. And for a lot of us, especially in the winter, that means using, lotions or ointments to make sure that skin is a nice barrier to keep out pathogens. If you have, tiny, tiny cuts in your skin, oftentimes that can cause a lot of problems. Don't smoke. Smoking not only impacts those cilia, those little hairs that keep things out of your lungs, but it also depresses all of the immune cells throughout your body. Similarly, minimize alcohol. Drinking alcohol in moderation is okay, but excessive alcohol intake also decreases the function of all immune cells. Reduce stress. Now we're getting into the hard stuff. So stress can cause overdrive of the non-specific parts of your immune system and can make your immune system less likely to function normally. This has actually been studied on the cellular level, that when you're stressed out, your immune system does not function as well. Part of that includes getting adequate sleep. Your body needs sleep for a number of things, including feeling well, reducing stress, but also sleep in and of itself is restorative to all parts of your body, including your immune system. Most adults need 6 to 8 hours of sleep per night. And finally, maintaining a healthy weight. Part of that is through good nutrition and staying physically active. But as you have more body mass and obesity, that also negatively impacts the function of your immune system, including all of the things that we talked about. Next up is something that we've heard a lot about recently, minimizing exposure to disease. Some of this is fairly easy and straightforward, but this is incredibly important because you can't prevent disease without minimizing kind of being exposed to it when at all possible. So washing your hands frequently or using an alcohol-based hand sanitizer. Now, I will say sometimes that's not so great for your skin, so really be mindful of that and use lotion as needed because you don't want to hurt your skin health too. But washing hands will prevent you from having all of the things that we pick up on surfaces transfer to your hands and then transfer to other parts of your body where they can cause infection. Similarly, avoid touching your face. So it's very, very hard, and I just adjusted my glasses. But if you touch your eyes or your nose or your mouth, you're potentially introducing pathogens from the outside into your body unnecessarily. Avoid sick individuals. So if you're sick, don't go out in public. If you know somebody is sick, you probably shouldn't be going and visiting them. This is kind of the basis of social distancing, staying 6 feet away from individuals if you don't know if they're sick or not, which sometimes is the case right now. Wear a mask when you're advised to do so. So for example, in Franklin County right now, we are advised to use masks when we're indoors, because there is a high number of COVID-19 cases right now, regardless of your immunization status. That helps protect you from the respiratory droplets of others. And likewise, it prevents you from transmitting respiratory droplets, which can contain bacteria and viruses that cause infection to others. In the winter especially, it's important to keep air humidified. This kind of impacts health in a couple of different ways. First off, when air is humidified, it's thought that the viruses and bacteria have a harder time transmitting between individuals. And then second, when air is humidified, it helps those mucosal surfaces, so your nose and the lining that goes into your lungs and those cilia, it helps them function a lot better. So that is another way that you can promote immune health. And then finally, not thinking of respiratory illness, but thinking of foodborne illness, make sure that you're properly handling and cooking food thoroughly. Making sure that you're not, cross-contaminating cutting boards with raw meats and vegetables to make sure that you don't acquire an unnecessary gastrointestinal illness. Another challenging part of immune health is making sure that all of your other chronic diseases are under control. I mentioned earlier, when you have diabetes, your blood sugar is too high, and that can cause your immune cells not to be able to function well or at all. Some other diseases that impact immune health: COPD is a chronic respiratory disease of the lungs. That means the lungs don't function as well as they can, and they're very susceptible to infection. It harms the cilia, again, those little hairs that kind of keep bacteria out of your lungs, as well as the lungs themselves. High blood pressure and heart disease can also impact your immune health. When your body overall is not functioning, when your heart is not functioning as it should, you can't pump those lymphatic tissues or the lymph from other parts of your body, which contains all of those good immune cells, all those lymphatic cells. So definitely making sure that, and those are just a few examples of chronic diseases that impact immune health. Almost every chronic disease that exists does impact immune health in one way or another. So staying on top of your health, seeing the doctor regularly, and making sure that you're doing everything you can to stay healthy as possible, even with these chronic diseases, is really important. All right, now we're getting into the nitty-gritty. Avoid unnecessary interventions, and you're going to see some asterisks here. So unnecessary antibiotics can cause worsening of your immune health. What does that mean? So antibiotics are specific for bacterial infections. So things like penicillin, Bactrim, sulfa drugs, azithromycin, those are examples of antibiotics. They specifically fight bacterial infections. They're ineffective against viral infections. So oftentimes you may have symptoms of an illness and you don't know whether it's viral or bacterial. You go to the doctor, and that's their job, is to determine, is this a virus or is this a bacterial illness that needs antibiotics? Sometimes people will request antibiotics for an infection that is a viral infection. And those antibiotics not only will not treat the viral infection, but might kill a lot of those good bacteria in your microbiome that can cause you to have more infections in the future. And those other infections are likely to be resistant to antibiotics, which is a problem, because if you need stronger and stronger antibiotics, oftentimes you can have more and more side effects. And sometimes you may even need to be hospitalized for an infection that could otherwise be treated with antibiotic pills that you could take. So antibiotics are incredibly important to take when you do have a bacterial infection that your body can't clear on its own. I absolutely am not saying don't use antibiotics, but make sure that the antibiotics that you're using are because you truly need them. Similarly, steroid medications can negatively impact your immune health. Steroids are medications that are given when you have a lot of inflammation in your body. That can happen for a number of reasons, including some of those, immune system gone awry reasons, like autoimmune disease, allergies, and even sometimes in infections, your body's immune response is much stronger than it needs to be, and steroids can be helpful. However, again, sometimes steroids can be prescribed when they're not so much necessary. And steroids inherently are immunosuppressant drugs. They work by depressing your immune system. So if you take them without needing them, you're causing unnecessary immunosuppression, and that can cause you to be more likely to get an infection. This last one here is one that we don't necessarily always think of. And many people have acid reflux, and many people have acid reflux that's not treatable with just regular dietary modification alone, and you do need acid reducers. However, sometimes acid reducers are taken for long periods of time without necessarily needing to take them for long periods of time, and they can reduce your stomach's innate response to kill bacteria and viruses. When you take acid reducers unnecessarily, sometimes that can lead to things like pneumonia even. Again, these are all things that you need to have a conversation with your doctor about. These are all things that it's my job as a doctor to make sure that I'm being good in terms of my stewardship of using medications when they're indicated and not using them when they're not indicated. Another one that you should know is getting immunized for preventable diseases. So this is a way that you can take charge of your immune health by proactively trying to prevent a disease. So for example, if you get immunized with the pneumonia shot, you're going to be less likely to have pneumonia. Similarly, I recommend immunizations for influenza and COVID-19, as well as shingles. And there are a whole list of other immunizations that we recommend. I recommend that you review the CDC recommendations for immunization for adults if you want more information. But again, immunization is, a killed or some sort of virus or bacteria that's not going to give you an infection, that's given to you in an injection, that allows your body to create that specific immune response before the real deal comes and attacks you. So that when the real deal comes on, like a pneumonia, your body can fight it off before it even causes an infection. There are also medications that you can take if needed that can help immune health. And you'll see two on here that were on my slide of things to avoid unnecessarily. So antibiotics, if you have an infection, bacterial infection that your body can't handle on its own, like a pneumonia or like a urinary tract infection, you will often need to take antibiotics. These are prescribed by a doctor. Some viral infections also have specific antivirals that you can take that can help your body fight them. Steroids, again, can be helpful when your body has an infection and your immune response is in overdrive and it's causing lots of problems and inflammation in your body. So again, prescribed by a doctor in the right setting, that can be very helpful to help you recover from an illness. Specific antibody infusions are available for some illnesses, such as COVID-19, to help boost your body's response. So, as I mentioned before, you don't necessarily form antibodies to something until you've been exposed to it before. But sometimes we can, purify antibodies from other humans, or we can create antibodies that will help, that we can inject into you, that can help your body have a more robust immune response, since you don't necessarily have those antibodies right away. Again, that's something that we've been using more for COVID-19, but it's also used for some other diseases. Many times I get asked, what supplements can I take to help promote immune health? Some specific ones that I get asked a lot about are antioxidants, vitamins, probiotics, zinc, echinacea, and elderberry, and we're going to go through these in a little bit more detail. I will say that the NIH has a lot of really good information on supplements, and they have this website. Actually, if you just Google NIH supplements. It's the first one that comes up. And they have fact sheets on just about any supplement that you can think of. And it'll tell you kind of what the supplement is, what is it used for, what's the evidence for it, is it dangerous, and can it interact with medications? And they even have a specific fact sheet specific for COVID-19. A few cautions when talking about supplements. Remember to always tell your doctor any supplements you're taking, just like a medication. There can be a lot of interactions between supplements and certain medications, and it's important for me to know as a doctor exactly what you're taking. You don't necessarily need to stop taking something, but I need to know so that I don't prescribe something that's going to interact and cause side effects, or that I'm making sure that I'm prescribing the right dose of medication for you. The other problem with supplements is that they're not well regulated by the FDA due to a law that was passed in 1994. There are some third parties that will review supplements and will test them to make sure they are up to quality standards and contain what they say they're supposed to contain. Unfortunately, the law doesn't actually require that. So we are forced to rely on these third party regulators, which you can see on the screen some examples. I recommend USP, NSF, or Consumer Lab. So if you're purchasing a vitamin or supplement, look at the label and it should have one of those labels on it. If not, there's not any regulation from the FDA that it actually has to contain what it says on the bottle that it does contain. And oftentimes supplements can be cross-contaminated with other supplements or even pharmaceutical prescription drugs. And we don't find out about that until something's reported to the FDA on the back end. So something could have been on the market for years before that happens, unfortunately. So look for one of those labels and you should be safe. So let's go through some of those specific supplements to learn a little bit more. So one that I think I've heard about since I was a really little kid was vitamin C. It's a natural antioxidant. It's found in citrus fruits, but also lots of other fruits and vegetables. And it's a supplement that's added to a lot of foods as well. Now, if you take vitamin C supplements regularly, you might be less likely to get a cold. You might be less likely to have as long of a cold, so you might have a shorter cold if you do get a cold. Taking vitamin C once you do get a cold hasn't been shown to do anything. It's pretty hard to overdose on vitamin C, which is a good thing, and it's definitely not harmful to take. So if you want to take a vitamin C supplement during cold and flu season, I think that's a reasonable thing to do. Like with all of these supplements, there's no robust evidence in regards to vitamin C and COVID-19. Vitamin D is another vitamin that I routinely recommend for my patients because most people are deficient. The natural way your body acquires vitamin D is your body actually produces it when exposed to sunlight. But here in Ohio, it's often gray and we have long winters and we wear clothes that prevent us from creating vitamin D. And many of us have a hard time creating vitamin D ourselves, even without those factors added. There's not a lot of evidence in regards to the effect that vitamin D can have on your immune health. If you're trying to consume it through foods, there are a lot of foods that are fortified with vitamin D, mostly dairy products or non-dairy alternatives. But if you want to eat liver or fatty fish, those are ways that you can acquire vitamin D through your diet. Most people, most adults, are fine if they take a supplement with 1,000 international units of vitamin D3 every day. The daily value is about 400 international units, but when you factor in the fact that most people are a little bit deficient, 1,000 seems to be a safe level. You can very easily take too much vitamin D. So unless the doctor tells you to, don't take more than 4,000 international units daily. And if you take too much vitamin D, it can cause very serious problems with your kidneys, heart, and bones. So definitely use it with caution. But this is one that most people can take pretty safely at a reasonable level to help promote general health. Vitamin E is another antioxidant. It's found in a lot of plant foods and vegetable oils. It's also fortified in a lot of different foods. It's another one of them that you can overdo though. So if you take more than 1,000 milligrams daily, you can have very, very severe effects like bleeding, stroke, cancer. Definitely not something you want to overdo. The normal recommended amount is 15 milligrams daily. And there's not a lot of evidence that taking more than that is going to be harmful for you. So I recommend sticking with normal supplements and not doing mega supplements of vitamin E. Probiotics are a great vitamin or a great supplement, not vitamin, that I recommend routinely for many of my patients. They're a way that you can help boost those good bacteria or good yeast that live in your GI tract. So like I said, we all have bacteria that live in our GI tract. Some are good, some are bad. This helps boost up the number of those good ones. You can naturally get probiotics through yogurt or some other non-processed fermented foods. And some foods have probiotics added as well. There's some good evidence that consuming probiotics can help with irritable bowel syndrome. And if you have to take an antibiotic for something, it can help mitigate some of those side effects that happen. So a lot of times when you take an antibiotic, you'll have diarrhea with it. And taking probiotics with your antibiotic can help prevent that. And they're pretty safe. Unless you're severely immunosuppressed, you can pretty safely take a probiotic. Zinc is another one that I hear a lot about. It's one that's been studied. It might help reduce the duration of the common cold. It's naturally found in many foods. Most people in the United States get their daily zinc through meat, but it's also found in beans and nuts, whole grains, and fortified products. Again, like all of these, it's insufficient evidence in terms of if it's helpful for COVID-19 or not. You can overdo zinc, which can actually hurt your immune system. It can also hurt your cholesterol. And high doses of zinc do interact with several different medications. So while zinc is essential for immune health, zinc is essential for the function of all of those different white blood cells that we talked about earlier. It's pretty easy to overdo it. It's also pretty easy to underdo it if you don't eat a healthy, well-balanced diet. So taking a low dose zinc supplement might be okay, especially if you have a deficient diet, but definitely don't overdo it because you're going to cause more harm than good. Echinacea is a botanical supplement that often I get asked about. It might slightly reduce your chances of getting a cold if you take it. It's not going to shorten the length of your cold if you do get a cold. It hasn't been studied in COVID-19, just like everything else. It is safe for most adults unless you have severe immunosuppression or cancer. It's probably fine to take echinacea. Some people get GI upset. That's probably the most common side effect that I see. Or sometimes you can get a rash with it. Elderberries become really popular over the last few years. There's some evidence that it can reduce the duration of a cold. Again, we don't have enough information for COVID-19. The flowers and ripe fruit are safe to eat, and that's usually what's in supplements. Just if you're doing your own elderberry, the bark, leaves, seeds, raw fruit, and unripe fruit can be poisonous and can cause major GI upset and dehydration and can affect your blood sugar. So definitely either use a purified supplement, one with those nice little USP, NSF, or consumer lab labels, or use the ripe fruit or flowers. So I have talked a lot about a lot of different topics this morning. So I want to give you some resources that if you can look to for reliable information. I already discussed the NIH supplement page, which is great, and it's definitely consumer facing, so it's written for, everyday people, not just for doctors, although they do have specific pages for doctors. So these are places that I typically will recommend that my patients look at, or I'll even use some of their patient information. So the CDC, the World Health Organization, the NIH, National Institute of Health, Mayo Clinic has probably some of the best patient handouts that I've ever seen. Harvard actually has a really good article on immune health. If you just Google Harvard immune health, it's really fantastic. Cleveland Clinic, Johns Hopkins, and then of course here in Central Ohio, I love the information that is put out by OhioHealth. And for children, I really like Nationwide Children's. They have a lot of really good handouts. One last plug. Again, as a family physician, probably one of the most important things that you can do for immune health is take care of yourself, seek regular preventative care, and talk about these things with your doctor. If you don't have a primary care doctor or you're looking for a new one, there's a Find a Doc website through OhioHealth that you can go to. And that is it. Thank you so much for your attention this morning. And I have one more slide. Because I have pictures of my children, because that's another question that I'm frequently asked. So on the left, you'll see Nolan, he's 3 months old. And then on the right, you'll see my daughter Iris, she's 3 years old, and Nolan's in the background there too. So I'd be happy to answer any questions or really anything that you want to hear about.
I really don't have questions. It was I felt very helpful overview, reinforced a lot of things I was already aware of, and I wrote a few notes down of some things to perhaps ask my own doctor about.
I have a question, and it's something that I know that there are so many multivitamins on the market. Mm-hmm. Would you stick your neck out and say, would you have top 3 pick?
I like one a day because they don't go super over the recommended value of a lot of different things. Similarly, Centrum is also really good. Nature Made is another one that would probably be my number 3. They do sell some mega doses of vitamins that I don't necessarily recommend though. But they are reliable in terms of they have the USP seal on it. So you can be pretty confident that you're getting exactly what you say that you are.
Those three brands, one a day Centrum and Nature Made.
Mm-hmm.
Wouldn't it also be appropriate to say that look at the labels on one a day or Centrum, and there may be a store brand?
Absolutely. Yes.
Generic.
Jean, that is a great point. And I actually recommend this for all name brand vitamins, over-the-counter medications, prescription medications, because oftentimes there's the store brand or generic equivalent. Again, like you'll want to make sure that the amounts are equivalent. But if you're comparing label to label and it's the same, or if you're comparing label to label and it's all like 100%, again, I caution against the mega doses. If you're going, 1,000% of daily value, oftentimes there's not going to be a lot of benefit. But yes, store brands are great.
Well, and the retail companies, CVS, Meijer, Kroger, typically they'll have a generic right exactly next to the brand name with a similar packaging, but you still want to pick it up and compare.
Definitely compare, and oftentimes it'll say compare to. And then you actually know what to pick up, and the stores won't like to tell you this, but often they purchase it from the same manufacturer. So it's oftentimes literally the exact same thing, but they can't tell you that, of course.
On the other hand, it wouldn't give much reliance to popular thing as seen on TV.
That's true. And no, that was not one of the things that I recommended in terms of how to choose a supplement.
What's
I might also ask you, I have a terrible reaction to poison ivy.
Mhm.
And I have not been successful in many instances what to do with it. And it spreads, and cold water, washing all the fabrics, all the stuff. I haven't had a breakout in probably 4 years, which is
Awesome.
great. I'm very much diligent about washing the clothes and keeping track of things, but I guess skin in general are there some really good tips on to keep your skin healthy?
Yeah, so poison ivy in and of itself, that's an allergic reaction. So sometimes you need steroids. And again, like, avoid them when you don't need them. But with poison ivy specifically, like, sometimes that's the answer. And of course, through a prescription through your doctor. Skin health in general, my favorite tip to give, again, especially during the winter months, but really anytime, is to use a thick, greasy emollient. So something like Vaseline or Aquaphor to keep your skin hydrated, and apply it immediately after bathing. So like, pat dry from the shower or bath and immediately slather on the greasiest thing that you can find. Now, again, Vaseline or Aquaphor are two that I recommend strongly. Some areas that I see people make mistakes are they bathe too frequently. So more than once a day, or honestly every other day, is normal for most people. Of course, if you're exercising, you increase the amount of bacteria on your skin and you do want to wash after that. But cleansing every day or every other day is often plenty enough. And then using really, really hot water, even though it feels good, and it feels good when you have itchy skin, it actually dries things out and makes it worse. So that was a
I teach swimming lessons, so I know what you mean.
Oh yeah.
Slather on the
Yes,
on
and Vaseline, or the generic equivalent, is super cheap and just as good as some of the
humidity is an issue in many environments because, where I live, there's no built-in humidification in the apartments. And, I've considered getting a separate humidifier, but, they from what I've read, require a lot of maintenance. You can get bacteria and so forth if they're not properly. Besides, space-wise, it's difficult to find the right size or someplace to even put it in a small apartment.
And for living in a small apartment, one easy way, they have UV sterilized humidifiers now. I actually just bought one for my home. It's only going to be good for one room. So usually I recommend it in the bedroom at night with the door shut. But the UV light sterilizes it, so it stays super clean.
What do you call it? I'm sorry.
It's just a UV sterilizer / humidifier. And oftentimes the cool mist humidifiers are really nice as well.
Yeah.
So I recently purchased one of those for my home.
What about the old-fashioned putting the pot on the stove?
I mean, that works too, or the steam from the shower. Sometimes those old remedies are actually the most effective.
My mom used to do that all the time in her apartment. She'd boil the water and get the whole thing of water in the air. So I think it helped. Okay. Well, Catherine, did you have any questions today?
No, I had to walk around a little bit. And when you were talking about the long-term problems, I have Sjögren's disease, and it's very hard to find out very much about it. I just know it dries things up in you, and it's not so bad I have to take anything for it or anything, but it's uncomfortable knowing you have it.
Yeah. And that's, I'm very glad that you don't have too many severe symptoms requiring a lot of different medications for it. And some of these diseases impact your life minimally, and sometimes it can be life altering to the point that you can't function, even the same disease in a different person. So there is a doctor at OSU that writes a lot about Sjogren's disease, so I would recommend looking into her.
Thank you.
Maybe if, Dr. Taylor, you could get that information, the contact, and I can forward that to Catherine.
Yes, that would be wonderful.
That'd be great.
Thank you.
Well, thank you so much, Dr. Taylor. That was wonderful information. I know that it's scratching the surface, but I think that we have a lot to do for ourselves. And I, for one, I'm going to look up a multivitamin. That'll be my new thing. So, well, thank you, Jean and Catherine, for joining us as well.